Hi and welcome everyone. We'll just give it another moment as folks trickle in. All right, so thank you all for joining us today. As I'm sure many of you know, September is National Preparedness Month. And I feel several of us think about this in the sense of natural disasters like hurricanes, tornadoes, and other things that are out of our control. Well, it also includes infectious diseases. So we're glad that you're here with us to discuss the uncertainty and to focus on the readiness for potential infectious disease outbreaks in the workplace. We have already started to get into cold and flu season, and we're looking forward to helping businesses and organizations address and prepare for these health risks. With that being said, we are excited to be here today with Dr. Lisa Koonin. Lisa founded Health Preparedness Partners after her 30-plus year career with the CDC. She currently provides consultation to businesses and organizations about planning for and managing infectious disease outbreaks and other emergencies. In this role, she provides practical and detailed guidance to inform updating emergency response and business continuity plans, and guides organizations as they gather lessons learned from the COVID-19 pandemic to develop and update emergency planning for a future pandemic or health emergency. So thank you for being here with us today, Lisa. Today will be just a simple Q&A between myself and Dr. Koonin. So throughout any time of the course of this webinar, please feel free to pop any questions into the Q&A and we'll be sure to address those at the end. Today's webinar will also be recorded and sent to all registrants. So let's go ahead and get started. How are you today, Lisa?
Hey, great. Thank you, Morgan, for hosting me today. I'm excited to have an opportunity to share this information with you and your audience. And, there's a lot going around. You have some questions for me?
I do. So we'll go ahead and kick it off. So we've heard a lot about bird flu in the last few months. So just kind of talking about that first, how dangerous is the bird flu?
Well, thanks for asking that question. There's a lot of information in the media about bird flu, and I think some of it's confusing. So let me just start with a brief background on the bird flu virus. So avian flu or bird flu is a highly contagious viral disease that affects domestic birds and wild birds. And the bird flu that's circulating now is called highly pathogenic H5N1 avian flu. That's a mouthful, but that is what's circulating now in the US among wild birds, domestic poultry, and dairy cows. It's called highly pathogenic because in most cases, if a bird becomes infected with it, it causes severe illness and death. Fortunately, this virus rarely affects humans. However, there have been human cases, and that's why we're focused on discussing it today. The first human cases were identified back in 1997 in Hong Kong, and public health has been tracking this virus very closely since. To date, there's been about 900 human cases reported from 23 countries. And until recently, most of these cases were in Asia. If a person gets sick from a bird flu virus, it's ranged from having almost no symptoms to mild illness to severe disease. And in fact, half of the early cases were fatal. So in addition to the virus causing severe outcomes if a person becomes infected, the other reason this virus has been so closely watched is because it has a risk to evolve to transmit more easily between people. If a virus jumps from an animal species to a human disease, that could spark another pandemic, just like the virus that caused COVID did years ago. So that's the reason scientists worried about this virus, because it continues to circulate and it continues to change over time. So mostly migratory wild birds, especially waterfowl, have played the role in spreading the disease. But we have seen a new wrinkle in this since March of this year, and that is dairy cows becoming infected as well. The U.S. Department of Agriculture have reported this virus in over 200 dairy herds in 14 states, and 48 states have reported outbreaks in poultry. So this virus is all over the U.S. and animal populations. In addition to wild birds, dairy cows, and poultry becoming affected, there have also been a number of cats who live on dairy farms that have also been affected. And unfortunately, most of these cats have died from the disease. There have only been 15 human cases in the US since 2002. That is good news. It's rare. 4 of them have been associated with workers in dairy farms. 10 of them have been associated with people who work closely with poultry. And almost all of these people have experienced mild illness and have recovered. However, the latest case, the 15th case reported in Missouri, that's the one that's most concerning. That's the one that people like me who track these viruses have got our attention on. And it's worrisome because the person has no reported animal exposure. We just don't know how they got infected. We just also learned that someone in their household also had become sick with a mild illness, but they weren't tested. So there's no information about it, whether they had the same illness. And although this person did not report any animal exposure, lab tests on the virus are closely related to the US dairy cow virus. So there's a mystery we don't have solved yet. Okay, now let's get back to your question.
Yeah.
What about people?
So very,
So,
very interesting. Yeah. So is this a real risk for most people? And who is at risk for this disease? I know you mentioned people that work on dairy farms,
yeah,
but anyone else?
basically the risk is for poultry workers and dairy workers and not for the general public. And CDC had said that the risk to the general public remains low at this time. And there's one other cautionary note, though, I want to insert here, and there is a definite risk in drinking raw, unpasteurized milk. We have seen that there are high levels of this virus in raw milk. And although several states have legalized the sale of raw milk for human consumption, this is a way that a person could be exposed. So just to be safe, public health experts advise not drinking raw milk or giving it to pets right now.
All right. So what steps should employers take if they have employees at risk of exposure to this disease?
So people who run businesses with that are taking care of live animals such as dairy cows and poultry need to check in with CDC's website about how to protect their workforce. There are some specific recommendations for that workforce in order to protect them from this virus. And I would encourage them to look on USDA's website and CDC's website to get that information.
Great, thank you. So what about monkeypox? There's recently been a large outbreak in Africa. Should businesses be concerned about that disease?
Well, actually, they changed the name now. It's called Mpox. And in 2022 and 23, like you said, there were big outbreaks in Europe and the US. The thing that's going on now is that there's a new variant of Mpox called Clade 1, and it is becoming more and more concerning in Africa, especially the Democratic Republic of Congo. And recently, a few cases have been detected in other countries from travel in Sweden and Thailand. So there are no known cases of clade 1 mpox in the US. And so the risk to the general public is considered low. The problem with the clade 1 is it's much more contagious and it's more deadly. So the US has a surveillance system in place to detect it. There's also a vaccine that's been developed and it seems to be very effective at preventing this illness.
Well, that's great to hear. So, in addition to bird flu and Mpox, what other diseases or health threats are you tracking right now?
Well, folks like me know that it's important to constantly monitor for emerging viruses because viruses are always changing. Sometimes we see a new virus, it emerges, it goes away, and sometimes we're surprised when it continues to circulate. You may have heard through news reports that we're really seeing a large increase in illnesses caused by mosquito bites this summer. And there is concern about illnesses spread by mosquitoes, even though they don't cause a pandemic, meaning a person sends that illness to another person, they can still cause pretty severe illnesses. So when a mosquito becomes infected, they do that because they bite a person that has an illness, and then when they bite the next person, they can spread that virus to other people. Two trends are emerging. First of all, mosquito season is lasting longer, so we're seeing more time for exposure and more mosquitoes. And also, second, that diseases that were once rarely seen in the US are now starting to happen in greater numbers. So warmer temperatures last year and this year have prolonged the season, and so we're really seeing a lot more exposure to mosquitoes. Listeners may have heard in the news about a surge of people getting sick from mosquito bites from West Nile virus, from EEE or equine virus, and dengue. Let me just talk briefly about each one of those.
Yeah.
West Nile virus has been around for several years. People have heard of it. About 1,200 people get infected a year, and about 20% of those people develop just mild symptoms. This year, there have been cases in about 40 states, and 70% of the cases have been serious. I think we just heard about Dr. Anthony Fauci hospitalized with West Nile virus and several other notable folks. And authorities are really concerned that people need to take precautions to prevent mosquito bites, especially in areas where they're circulating. Eastern equine encephalitis is EEE, also called that, is a rare but deadly virus spread through mosquitoes. And in Massachusetts, they've started closing parks after dark and restricting outdoor activities because this virus is circulating. And finally, we're seeing an uptick in dengue in the US, and dengue is also a virus spread by mosquitoes. In this year, there's already been over 4,600 cases. Last year, there were far fewer. And so we're seeing an increase in this. And dengue can cause anywhere from mild symptoms to severe illness. But people can get really sick, and it can cause a lot of severe illness. The thing about dengue is we're really seeing an explosion of it in South America and in Puerto Rico. So it's really important that travelers, businesses that have staff who travel to Puerto Rico and other countries where these diseases are present, to also inform them about how to take protective measures. And then I do have to mention COVID-19. It's not gone away. We see it still circulating, and there's been a new vaccine that's just been approved and tested and released. That's a booster. And CDC advises that everyone 6 months and older get that updated vaccine. The vaccination can work effectively at preventing people from getting very sick, being hospitalized, and dying from COVID.
Yeah. No, I'm glad you mentioned the COVID and the new vaccine out there because that was just really, really, really recent. So glad you mentioned that. So how can safety professionals assess the specific risk to their businesses for these outbreaks? And what are some resources they can turn to for reliable and accurate information?
Yeah, thank you for that question. It's really important because the media is not necessarily the best source to track these kind of things. You really need to go to more reliable sources. And different businesses have different risks. If you have a business where a lot of your folks are working outdoors, they may be more prone to mosquito bites. If you have poultry workers or dairy workers, we've already talked about that. So it's really important to assess the risk of your workforce and in the community where your business is located and where your employees live. So, it's important to kind of scan the horizon for all types of threats, weather threats, trends in infectious disease, natural disasters. All of these things should be on the list. Because once outbreaks evolve, they can go very quickly, and it's really important to be attuned to it. It's also important to know where to get reliable information, like you said, from local and state health departments, CDC, the World Health Organization, and other sources. And finally, it's really important also to monitor international outbreaks, even if your business does not have an international setting. Diseases that start elsewhere can jump to the US really quickly. And that we saw in the COVID-19. I remember in very early January 2020, seeing some notices of a mysterious and severe pneumonia that was affecting people in China. And because it seemed to be expanding and spreading there, I kept my eye on a report from WHO and also from ProMed, which is a free news service that monitors infectious disease all over the world. Um, just thinking back, having advance notice or an early warning can allow a business to get ready and to be able to launch their plans. If you had known what was going on back in January of 2020, well, what would you have done? If you had that insight 2.5 months before COVID became a problem here, would you have ordered critical supplies, developed any new policies, brushed off your emergency plans and made sure they were up to date, or conducted tabletops or other exercises? By having sort of a bird's eye view, so to speak, on what's going on, it allows you to get ready. And so I suggest thinking about how you can monitor what's going on, not only in your community, but also around the world.
Yeah, no, that's great. And that definitely, I'm sure a lot of folks on the call today are probably thinking if they would have known back in January of 2020, all the things they would have tried to prep for, till we got to March. So that's a very good point there. So what steps can be taken to protect people from these kinds of viruses?
Yeah, we've talked about the bird flu, and if you have poultry or dairy workers, it's really important to protect them. Otherwise, just staying vigilant. If you hear of any kind of strong outbreaks of flu or novel flu this flu season, it's important to be able to stay tuned into local public health. Um, think about your employees that travel, especially if they travel internationally, and what you can help them with in terms of protecting themselves. And it's important also to recommend that people get vaccinated, especially like for COVID. It is really important for people that are higher risk for complications, such as people who are 65 years and older, people who are pregnant, those who are immunocompromised. Those folks should definitely talk to their medical provider about getting updated. But also there's some things that we learned from COVID that can also be important protective strategies. And that includes making sure that you have sick leave policies that allow sick people to stay home. With flu and cold season coming up, if people have a fever or they have respiratory symptoms, they really shouldn't come to work. They can expose other people. And so, even though it's not typical for folks to work from home these days because we're moving everybody back to the office, if they're sick, they need to stay home. We also learned how important HVAC systems are in buildings. When buildings are built, they're airtight and they don't let fresh air in usually much unless the HVAC system does that. So having certain kind of filtration, airflow, we've really learned the effectiveness at reducing infectious diseases in those spaces. So it's really important to, we're approaching fall now, so HVAC systems are, usually inspected before the heat season comes in, where you turn the heaters on. Talk to your HVAC people about what can be done to improve the air quality inside the space.
So mentioning, I'm going to go a little bit on a tangent here, but so you mentioned about like the HVAC in buildings and stuff. What would you recommend for homes and families, like in their own personal space? Would you recommend something similar, changing out the filters more often, getting different ones? Do you have any thoughts on that?
Yeah, so it applies to homes too. You're trying to get the most effective filters that would fit in the system, talking to your HVAC folks about what would work. During COVID, CDC was recommending the MERV 13 filters as the way to have optimal filtration. So can see if your system will accommodate that, or if you're wanting to do that. But it's also important to wash hands and do sort of the simple things, especially with cold and flu season coming. And it's important to pay attention to those things like that.
Yeah, no, the little things matter. So there's been a lot of pandemic fatigue lately. We had been talking about it for several years, and as you mentioned earlier, people are kind of going back into the office and kind of getting back to a new normal. How do you think this impacts future pandemic planning and response?
I have to say, I'm worried about that. The experience of COVID-19 has already adversely affected planning and preparedness because many businesses have moved on. They've not updated their plans. They feel like, okay, we got through that. We did okay. We don't need to pay attention. There's so many other pressing issues right now. We need to move on. And it's really important to stay on point and be ready to respond to a future emergency. As painful as it may seem, we have to accept that natural disasters and infectious threats are going to continue to strike. Um, One of the things that's also concerning is next time our employees may be less willing to adhere to our protective measures. There's been a lot of pushback about wearing masks, getting vaccination, doing some of the protective measures. And even if a business asked their employees to take certain steps, they could say no. And so really thinking about policies, procedures, what will you do to be ready on day one? That is what's really important.
Yes, no, I agree 100% with that. So always being a step ahead. So soon we'll be having flu and cold season. Is getting a flu shot this fall still recommended? And what other vaccines are important to get?
Yep, so the CDC still recommends annual flu shots and for everyone who's 6 months of age and older. And vaccines are available now at doctors' offices, clinics, and pharmacies all over the country, as well, like I said before, the updated COVID-19 vaccine. So they are widely available and they should be covered by most health insurance plans. As far as other vaccines, there are several new vaccines that have come into the marketplace and have been approved in the last couple of years. And I'll mention three vaccines that are recommended, but only for certain groups of people. And I think it actually gets a little confusing with so many vaccines and so many recommendations. So people should really talk to their healthcare provider about what's best for them. But CDC is also advising that people who are 65 years and older who have an underlying condition like diabetes or heart disease that places them at higher risk for severe outcomes need to get a pneumococcal vaccine. And then people who are 60 years to 74 years and older who also have these underlying disease are also recommended to get an RSV vaccine, which is a vaccine that came out last year. And those who will be pregnant in the time period from September to January should also talk to their doctor about getting an RSV vaccine. So there are some new ones out there, and people should really, speak to their healthcare provider about that.
No, great. Thank you for sharing that. And the other ones that are important to get as well. Should the threat of these infectious disease influence how businesses update and test their business continuity plans?
Yeah, so the title of this webinar is Navigating Uncertainty. I think my most important message today is to create or update a flexible business continuity plan that includes health risk, not just natural disasters or insult to the physical plant, but also some of these outbreaks and diseases. And equally as important as having an updated plan is training staff to use that plan by conducting exercises or drills. We've already talked about how important it is to monitor threats, both locally and internationally. It's also important when the annual business impact analysis, or BIA, is conducted to think about health threats and update business continuity plans from what you learned from that analysis. It's important that you don't just put your plan on the shelf. It's not sufficient just to have it in a notebook. It's really important to breathe life into it and test it and see if it will work. And it's important that the people who are going to respond to emergencies know their roles, know the plan, and are trained to execute. I think that no matter what the next threat might be, whether it's a natural disaster or an infectious disease or pandemic, if a business has a flexible plan with a team that know their roles and responsibilities, no matter what the threat, then the business is better positioned to protect its people, its business facility, and its operations. And finally, a successful emergency response also depends on the way that the business makes decisions during an emergency. Oftentimes, leaders have to make decisions rapidly with incomplete information, and this area can be a focus of exercises. If you get proficient in this, it will contribute immensely to the success of a response.
That's great. No, thank you so much. So do you have anything else you want to add or that you didn't get to mention before we open it up to the Q&A?
I just want to thank you for having this conversation today. I think, unfortunately, people are sort of like been there, done that with COVID. And so they moved on and they're not thinking about health threats as part of their business continuity and safety planning. And, by having this webinar today, we can put a little attention on that area and encourage people to include those in their planning. So thank you for launching this webinar today so we can talk about it.
Yeah, absolutely. It's always a pleasure. So I am going to open it up and share my screen here. And then see if we have any questions in the Q&A, which it looks like we do. So I'll go ahead and read those to you as well, if you're okay with that, Lisa. All right, so what are several specific steps planners can take now to improve the business's outcomes during a future emergency?
Okay, so sorry, there's some background noise here. I hope that's not bother. Well, when a new disease emerges that we've never seen before and causes an outbreak, there's going to be a lot that we don't know about it right at first. We won't know who's at risk, how it's spread, or how to protect against it. And the protective measures that are initially advised, they may change as more information is known. So it's really important to have a flexible emergency plan so you can pivot as you need to and as recommendations change. Second, we have already mentioned this, but it's really important that businesses have flexible sick leave policies so that people who are sick can stay home. We have evidence that during COVID, businesses that have flexible sick leave policies had fewer workplace outbreaks compared to businesses who did not have those policies. And also it's important to think about what kind of protective steps that your business might want to take. Do you have hand sanitizer? Do you have some face masks on hand? Just so that you're ready to go on day one. Those are some of the things that I would consider.
Great, thank you. Do you have any tools that businesses can use to get started?
I think there are a number of tools on Department of Homeland Security's website called Ready. FEMA has tools, and yes, there are a number of tools that can help businesses. Of course, if someone has a specific question, they can contact me and I'd be happy to help them.
Great, thank you. How should companies handle employees who are unable or unwilling to get vaccinated?
This came up a lot during COVID, and there are sometimes people who, for medical reasons, cannot get vaccinated. So those people were asked to work from home. If they had the kind of job where they couldn't work from home, they during the height of the outbreak, they were given different duties so that they could still stay, engaged and employed. And I think it's a question that really needs to be discussed internally in a business because it has to sync up with the culture of the business as well. So having those kind of conversations before an emergency strikes, just to be a part of preparedness, that is very helpful.
Yeah, no, that's definitely appreciated and a very tricky and difficult conversation to navigate with that I'm sure a lot of managers have with their employees and stuff. So, um,
I will say that it's not popular to have mandates for certain things, but if we look at the literature, healthcare businesses and facilities that did have mandatory vaccination had far fewer employees becoming ill and had far fewer outbreaks at the work site. So, there's pluses and minuses with both decisions.
yes, absolutely. What lessons have we learned from past outbreaks in COVID and how should they inform our current approach?
We've learned so much. I think we've learned just so much. I mean, first of all, with supply chains, people really learned about how fragile our supply chains are. And so that really can help us do some forward planning by having some stockpiling of critical, and essential equipment or supplies, alternative supply chains if one goes down, so there's another resource. Um, Also, communication with staff. It's really important during an emergency to have very frequent communication with staff. We never expected an outbreak or a pandemic would last as long as COVID did. And so we really did not envision that we would have to keep up protective measures for as long as we did. And that affected the mental health of a lot of people. And so building resiliency within the business, building communication within the business, those are things that are really important. And then really thinking about how to support staff if it is a long-term and dangerous situation. That kind of planning can go a long way right now.
Yeah, absolutely. And I will say, I have a public health background as well. And the silver lining of COVID was that it really put public health on the map, and brought a lot of light to it, as well as you mentioned too, the mental health piece. I think mental health has become much more easily talked about, between employees and supervisors. So that's been another little silver lining, I think, that came out of COVID as well. So
Yeah, I think you're absolutely right. And what it does is it really put the light on the attention to our staff as whole people, that have physical, emotional, mental needs that during an emergency or a crisis needs to be supported.
yes, absolutely. So a couple more questions. You kind of touched on this a little bit, but I'm just going to reiterate the question. How often should a company communicate updates about potential outbreaks or health risks to employees?
We live in a milieu right now where there's a lot of information. Some of it is accurate and some of it is not. And in this face of misinformation, sometimes the business plays a very important role to provide accurate information to staff that they can actually bring home to their families. So if there is a lot of media coverage about a certain issue, health issue, and it's in the local area where the business is located, it might be good for the business to get an accurate view on what's going on and be able to share that with staff so they know what the real deal is. I think during an emergency, I worked with many, many companies during COVID. It was important that they communicate almost every day because staff were anxious. They wanted to know what was going on. What was the business doing to protect me? What are the plans? You know, the biggest conundrum for businesses back in COVID was, when do we reopen our facilities again? And how do we know when it's safe to do that? And so we developed a framework to guide the businesses to do that.
Okay, great. Yes. So for employees that work primarily outside, what are some ways to protect against mosquito spread illness when the facility is in an area naturally surrounded by low and standing water?
Yeah. So the most efficient way of doing that is to provide those employees with insect repellent. There are a number of EPA approved insect repellent lotions, gels, and sprays on the market that can help protect workers. And it might be part of their equipment kit is insect repellent. Sunscreen and insect repellent might be two ways to protect those staff from environmental hazards.
Yeah, great. Would you also recommend wearing like long sleeves and, netting and stuff like that? Or,
Well, yeah, I recommend wearing long sleeves, but I hesitate because, with just experiencing the hot summer that we've had, not everyone's willing to do that. I mean, long sleeves and long pants certainly provide more, and socks provide more protection, but when it's 100+ degrees outside, it's hard to do that. But yes, you're absolutely right.
yes, thank you. What is the best source of accurate information for what is going on with current infectious disease risks?
So I think the best source is local. So developing a connection with the local health department during, if you will, peacetime is a really good move, because if you have a contact that you can ring up or email, or a way to tap into, look at their website and see what's going on locally, that's usually a very accurate way of finding out what's going on. On a national front, CDC's webpage, but it won't get necessarily at the community level. So I really encourage looking at local health departments, regional health departments, and really trying to create a partnership between the business and those health departments. And I think that'll go a long way during peacetime as well as during an event.
Yes, great, thank you. How should companies communicate with their employees, customers, and stakeholders during a health crisis? And what are the key elements of an effective crisis communication strategy?
There's been a lot of work on this, and CDC actually has free resources on its website for crisis communication. If you Google crisis communication CDC or go into the CDC website, there are training materials to help you. But basically, it's being being accurate, being honest, and being on time or as early as possible. So it's a really important to be able to communicate with employees. And I think businesses figured out that they needed to talk to employees, but not every business has a way to do that. And there's a number of systems and frameworks on the market that software you can buy for communication. But it's really important to figure out, how would you communicate with everyone on your staff in the middle of the night if you really, really had to do that? Do you have a way to do that? And if you don't have a way to do that, it is something really worth considering. As far as stakeholders, vendors, customers, it's also important. Your website is an important venue for that, as well as any direct communications that you have with those stakeholders.
Great, thank you. And thank you for providing the communication CDC resource. That's really helpful for folks. What steps should businesses take to ensure a strong recovery post-crisis? Good question. And how can they turn the experience of managing health risks into long-term business resilience? That was wordy, so if you need me to repeat anything.
No, I got it. I think, oftentimes We are so relieved when things get better that we don't pay enough attention to the recovery phase of a crisis. And a recovery phase is just as important as any other part of responding to an emergency. So in the recovery phase, we resume functions, we learn lessons from what happened, we update our plans so that we're more resilient. And, after action reports or, interviewing people, taking polls and surveys, really finding out about what worked and what didn't, that's a really important way of improving resilience. Anonymous surveys are best so that people feel a little more willing to tell you what's going on. And even though, COVID was years ago, it's not too late to think about those things, to gather people together to talk about what worked and what didn't. I think we would be surprised sometimes at what we get back when we do those kind of inquiries. And then to be able to make an action plan for each one of the areas where there was a deficit or where things didn't go as well. We don't want to repeat the same mistakes. And if we don't have corrective actions, then we will. So it's really important to resume our activities, but also to really learn from the experience.
Absolutely. What measures should be taken to protect high-risk employees or those with pre-existing conditions?
Well, the business cannot ask their staff about their personal medical status, so we don't want to do that. But information that can be put out to educate that high risk people need to take additional measures, such as get vaccines, or during an emergency, maybe they need to stay home and away from the work site. Those are the kind of things that I would consider. It's very important to be an accurate source of information. So be sure that when you post these pieces of information that you have a really good resource, and not just a news report, but something where you can really count on the reliability of the information.
Great, thank you. So it looks like that's the majority of the questions that were asked. Is there any other little tidbits or pieces of knowledge that you would like to share to the group before we close out today?
I would just say that broaching these topics with senior leadership sometimes can be encouraging or challenging, depending on what else is on their plate. But remembering the destabilizing effect that COVID had on our businesses, and experts expect another health emergency in the not too distant future. We don't know what it will be. We don't know what will cause it, and we don't know when it will be. But being prepared for that really helps protect our staff and our businesses. So I would encourage folks to really think about what they learned from previous incidents, how they can update their plans, and take the time to train staff, do exercises, have conversations so that you're ready when the next thing happens.
Great words of wisdom, Lisa. Thank you. And thank you all for who attended today. If you have any follow-up questions or want to discuss anything further, you can always reach out to us at safer@nsc.org. And like I mentioned at the beginning, we will be sending out the recording within the next day. So be on the lookout for that, and always reach out if you have any questions. So someone just asked if we can get the transcript. I believe that will be in the recording, and you'll have the option to view it with the transcript or without. So, but if you rewatch it and there's any questions you may have, feel free to reach out to myself, and we can connect you with Lisa if you have any further questions. So thank you all so much, and I hope you enjoy the rest of your day.
Thank you.
Bye-bye.